There's a saying that I and other health experts alike say, and it goes, if you lose the strength in your legs, you lose your independence. Our feet and legs are the foundation of which we function physically in our daily lives. Hello, everybody, and welcome to my very first online lecture and my senior capstone project. This lecture and the material within this lecture has been developed under the assumption that the person watching this has basic understanding of principles of health and wellness or is a health field student or professional. However, I presume there will be some folks who are not as familiar with topics regarding health, wellness, and fitness, and that my target audience may need a short review. So on the preceding slides, I have some basic keywords and concepts that you should understand before proceeding with the rest of this lecture. My name is Dominic Gabriel Pope. I am a health and wellness education coach, independent Olympic performance strength and conditioning coach, and elite individualized exercise programming specialist. I am currently in pursuit of achieving my master's degree in exercise science and sports nutrition, seeking a full-time leadership role in the military, academia, or clinical healthcare. The primary intent of this particular lecture is to briefly explain the importance of resistance training for older adults and discuss a sample program that I have developed for an older individual. On this slide, I have bulleted a few reasons why resistance training is paramount for older adults. And please take note that from this point forward, when you see or hear the mention of older adults, I am speaking about adults aging from ranges 45 to 65 within the general population. I have my own recommendations given to you as a practitioner. Perform 2 to 3 days of total body resistance training, allowing at least 36 to 72 hours of rest between sessions to optimize recovery and adaptation. Train at a moderate intensity, meaning the weight must be at least slightly challenging, using the rate of perceived exertion scale. The intensity should be a 4 to a 6.5 or 7 out of 10 for 2 to 4 sets of 8 to 15 repetitions per major muscle group. Beginners or absolutely deconditioned individuals may begin at an RPE range of 3 to 5 for 2 to 3 sets of 6 to 12 repetitions and progress gradually as strength and tolerance improve. The exception to the rule would be for power training. Then it should be 2 to 3 sets of a maximum of 4 sets. If you are a practitioner observing a client or patient, I recommend you follow the eye test bell curve theory. Prioritize functional movements that simulate daily activities. For example, squats for getting up and down, deadlifts for hinging at the hip and properly using the legs to pick up heavier items from the floor, overhead pressing to encourage mobility for reaching things off top shelves, etc., etc. Emphasizing proper technique, controlled tempo, and full range of motion to promote joint integrity and movement efficiency. Increase resistance or complexity gradually. Typically, a good range I have personally found to be tolerable for most older clients I have worked with is to go up 2.5 to 10 pounds every 2 to 3 weeks of training, or simply increase the tempo. For practitioners, this means TUT, time under tension, or number of reps within a given set of an exercise. All exercise should be progressed or regressed depending on the vast variables of yourself or if you're a practitioner, your client or patient, and incorporate balance, core stability, and flexibility components to reduce fall risk and maintain musculoskeletal health. I have developed a 3-day program designed to enhance strength, mobility, endurance, and functional independence in older adults through evidence-based, science-backed, low-impact training blocks that prioritize safety, posture, and joint integrity. In front of us currently right now is day 1, which is a strength day, and the focus is functional strength and postural stability. This session develops lower body power and upper body strength and trunk control using compound machine-assisted and bodyweight exercises. The goblet squat and step up improve sit to stand and stair climbing ability, while upper body work enhances shoulder mobility and posture. Core and balance drills reinforce trunk stability and fall prevention. Day 2 is mobility and functional conditioning. The focus for this day is movement control, joint mobility, and aerobic endurance. The second day emphasizes dynamic flexibility and cardiovascular health. Low load mobility exercises support joint range of motion, while elliptical conditioning maintains heart health without impact stress. Core and posture work targets spinal alignment and shoulder retraction to combine age-related kyphosis and imbalance. And day 3, my last day that I have on here, is integrated functional strength, muscular endurance, and controlled power output. This session combines multi-joint strength movements with light power training to preserve fast twitch muscle fiber activation and dynamic stability. Farmer carries, push-ups, and loaded marches improve grip coordination and gait confidence. A light cardio finisher sustains cardiovascular function while encouraging active recovery. Now, please take into account that this third day would vary client to client, and depending on the health of the patient, is more likely to be an optional day for most older adults. The overall outcome of this program balances strength, mobility, endurance, and stability, fostering independence, posture correction, and confidence in daily movement, all while minimizing injury risk through progressive, age-appropriate exercise selection and sequencing. Built this program based on both literary strength and conditioning guidelines for older populations and the experience that I have as a personal trainer when working with older adults. Again, my name is Dominic Gabriel Pope. I am a health and wellness education coach, independent Olympic performance strength and conditioning coach, and elite individualized exercise programming specialist.